G'day, I'm Jamel Boukabou, 2-star executive with Youngevity International. You're about to hear from the world-renowned, famous naturopathic doctor, Dr. Joel Wallach, book in the Smithsonian, author of the book Dead Doctors Don't Lie, which sold 500 million copies on audio, book in the Smithsonian, nominated for a Nobel Prize in Medicine, and recent keynote speaker at the Tesla event. I'm not a doctor or a healthcare professional, but I believe Dr. Wallach is the best naturopathic doctor on the planet. So please consult your own healthcare professional for health advice. I am a distributor, so if you do want to know about how to earn money while using the Youngevity products, contact myself or the person that's referred you to this video. Aloha. Recent keynote speaker at the Tesla event. Yep. And speaks at the UN, and I'm proud to say he's my mate. And we have a lot of quite new people on today. This call is for everybody. If you want to know about the business, please contact your upline or call the office and find out who your upline is, and they can show you how to earn money.
Oh, well, this is for the people who don't know Doc Wallach. He's been a friend of mine for well over 30 years. He is in the opinion of a lot of people, right through to the very top end, the UN and other things, this man is one of the sharpest people in the world on health, nutrition, right through from animals to humans. And I mean, I love some of his little one-liners, like it said that I treat my patients like dogs, but they do better. Thanks, Doc. All yours, my friend.
Okay, well, thank you so much. And I do deal a lot with professional athletes of all sports. I deal with Olympic athletes of all sports. I deal with university athletes of all sports. And there's some universal things. Some of the more famous ones are people like Evander Holyfield, big heavyweight boxer, and the Joe Louis fame. Some of you are old enough to remember the name Joe Louis, very famous heavyweight boxer. And Evander Holyfield was kind of that same genre, if you will. And he actually surrendered, would be the word, surrendered his championship because he had a heart attack. And to make a long story short, I rebuilt him with the 90 essential nutrients. And he had to fight to get his championship back a year and a half later. They wouldn't just give it to him, so he had to fight and get it back. He fought for 3 more years and defended his title 3 times a year for 3 years. What a wonderful story. And then we had a wonderful, who's still with us, Theo Ratliff, NBA All-American basketball player. He had bone-to-bone arthritis in his knees. He's only 27 years old, had bone-to-bone arthritis in both knees. He had cartilage pop off his hip. He fractured his wrist. And they broke his contract with the Atlanta Hawks because they said he was too fragile to play professional ball. So I gave him also the 90 essential nutrients and rebuilt him, and he got a $35 million contract, which says, oh, you're fit again, and we recognize that you're in good shape here, and we'll give you a $35 million contract. He played for 11 more years. And so these are the sort of things we do with nutrition and supplement programs. And you have to appreciate that the average lifespan of professional athletes, all sports combined, is 62, except for basketball is 51. So why is it that professional athletes who may make $500,000, $1 million, $2 million, $3 million per event or per game, and yet their average lifespan is not very good? Well, that's because they're more interested in energy than they are in long-term maintenance. And so what I have to do is teach them. And of course, we came up with CDs and DVDs and books and things like that so that they would have information. And I lectured to large gatherings of athletes of all ilks, again, the Olympics and professional and university and so forth, all over the world. Now, osteoporosis is a universal thing. Osteoporosis is a universal thing, and it results in about 100 different diseases. Osteoporosis, when you just talk about osteoporosis, most people think, oh, that's little old ladies get that. No, babies can be born with it if the mother doesn't have nutrition during the pregnancy, and the baby can be born with osteoporosis. Osteoporosis causes over 100 different diseases. All right, let's go over some of them. And again, osteoporosis is a deficiency of one or more of the 90 essential nutrients. It shows up in the musculoskeletal system But then, depending on where it is located primarily, you get all these weird things. Let's look at AFib, atrial fibrillation. Atrial fibrillation is an abnormal heart rate, okay, and also rhythm. And there's a famous story about a U.S. Congressman, Elijah Cummings from Baltimore, Maryland, and he had AFib, and of course the cardiologist at the medical school at Johns Hopkins there in Baltimore, Maryland said, look, you're going to get a stroke if we don't deal with this. There's a procedure we call ablation. We're going to identify the part of your heart that's running crazy, and we'll kill that part of the heart so you'll have a calm, regular heartbeat like you're supposed to. And they talked this Elijah Cummings into doing it. He was 68 years old. They took him to the hospital at the Johns Hopkins School of Medicine. They anesthetized him. They opened up his chest, cut his chest open, and they took a hot soldering iron and touched it to his heart, and he died immediately. Doctors went out and had a cheeseburger with a shake and said, boy, that was terrible. The next day, they couldn't remember his name. Okay. But that was caused by osteoporosis of the skull, squeezing the 10th cranial nerve, the vagus nerve, which controls the rate and rhythm of the heart. And they told him it was a heart disease. It was not a heart disease. It was osteoporosis of the skull. And if he'd have come to us, we'd have been able to give him a program, the Healthy Bone and Joint Pack with some MSM, some Pro-Joint FX, some vitamin D3, and collagen comes with the Healthy Bone and Joint Packs. And he weighed a couple 100 pounds, so he could have had 2 Healthy Bone and Joint Packs and all that kind of stuff. And we'd have fixed him by making his skull whole, getting rid of the osteoporosis in the skull. There's a disease which used to be called Paget's disease. Paget was a pathologist back in 1814, 1817, something like that. And he named it after himself because when he did autopsies on people, he noted that instead of having the normal thickness in their skull of 1/4 of an inch, their skulls were 1 inch thick. And it was the connective tissue was filling up all the tunnels that the 12 pairs of cranial nerves went through and filling up the tunnel that the spinal cord went through in the back of the skull, foramen magnum, Latin for big hole. And so he named it after himself, but he thought it was a genetic thing. So I've renamed it Wallach's disease instead of Paget's disease. I've named it after myself. People say, Wallach, you're arrogant. You name it after yourself. Well, I wanted to be controversial here because I didn't want people to go for another thousands of years thinking mistakenly there was nothing you could do about it because of the genetic thing. It's a simple nutritional deficiency of the skull. And there's 12 pairs of cranial nerves, so there's 25 different diseases you can get from osteoporosis of the skull. Okay? And age is not a factor. Gender is not a factor. Okay? Babies are born with osteoporosis of the skull, and they can be born paralyzed from the neck down. Erb's palsy, they call it. Now it's Wallach's palsy, right? Because it's a simple nutritional deficiency of the mother during pregnancy, and the baby got cheated, so the baby's born with osteoporosis of the skull, Wallach's disease, and all kinds of other stuff. And so this is why they have these problems at birth. It's not a genetic thing, although doctors will still tell parents, well, you got a bad gene in your family, blah, blah, blah. And of course, those doctors should go to jail. Now that same cranial nerve, okay, that causes, it's called the vagus nerve, the 10th cranial nerve, causes AFib, atrial fibrillation, also causes COPD, chronic obstructive pulmonary disease. It's a dry cough, non-productive, it's not an infectious thing, but people get it anywhere along their life. And it's because that same 10th cranial nerve is being squeezed, which controls the lungs and the diaphragm. There is a branch of that 10th cranial nerve called the recurrent nerve, which controls the diaphragm. And when that gets squeezed by osteoporosis of the skull, you get hiccups. There's so many people who go to their doctor and they say, man, I don't know what's wrong, but I get the hiccups and I'll have the hiccups for a half hour. It just drives me crazy and disrupts my day. What do I do about that? Well, we'll have to cut that recurrent nerve. No, you treat them nutritionally for osteoporosis, takes the pressure off that recurrent nerve and the vagus nerve, and the hiccups go away. All right. And then let's see here. Let's look at gastroparesis, extreme pain. I mean, we're talking extreme pain in the stomach. That same 10th cranial nerve goes all the way down into your stomach. And they'll do an endoscopic thing. They'll put a scope down your esophagus, down into your stomach and look around for an ulcer. Well, we got to take your stomach out and just hook your esophagus into your small intestine because you got such pain there. No, it's caused by that nerve being squeezed. We get them on the Healthy Bone and Joint Pack, extra MSM, vitamin D3, and get them off all the bad foods so they can maximize absorption. No fried foods, no processed meats, no oils or glutens. And the gastroparesis goes away and they don't have to have their stomach removed. Okay. Now, one that people are very familiar with is called Bell's palsy. Bell's palsy, where one side of your face droops. Usually it's one side, but it can be both sides. That's a squeezing of the 7th cranial nerve, the facial nerve, which is a motor control of your facial muscles. And then there's one called ONA, optic nerve atrophy, where people get a gradual blindness, and they, with this gradual blindness, they don't have cataracts, they don't have glaucoma, they don't have pressure in their eye. So the doctors will say, oh, you have macular degeneration. There's nothing we can do about it. We'll just have to give you new glasses every 3 to 6 months as your eyes get worse. But what happens is the optic nerve, which comes from your brain through the back, through the skull to the back of the eye, the 2nd cranial nerve is called the optic nerve, and it's being squeezed by this osteoporosis of the skull. It's the 2nd cranial nerve. Well, I actually had a wager. I had a wager with a doctor because I said I could reverse that, and he called me a liar. You know, the Q&A period of my meeting there in Salt Lake City, Utah. He said, well, let's have a little wager. I said, give me 12 of your patients who you've diagnosed with macular degeneration. They're legally blind, 6, 8, 10 years. Yeah, I've got hundreds of them. Okay, I'll bring 12 charts tomorrow. Well, the next day he brought 27 charts. He says, take your 12. I said, why? Let's take all 27. And so the wager was, if I was able to get them to see again in 90 days, get rid of their blindness in 90 days with a supplement program, that he would buy me a very expensive imported bottle of French wine, red wine. He'd take me out to Ruth Chris's steakhouse for a very expensive steak. And he would pay for all of these supplements for these patients. And he would apologize in public for calling me a liar. So make a long story short, put him on the Healthy Brain and Heart Pack, got him on the Ultimate Daily Classic tablets, got him off all the bad foods, including gluten, so they could maximize absorption, got him on the MSM, again, to help rebuild the skull. And in 90 days, I took all 27. In 90 days, 25 of the 27 could read 20/20 without glasses. Remember, these are all legally blind, 6, 8, 10 years. Took 2 more weeks for the other 2 to be able to read 20/20 without glasses. So he paid off, okay? And I do this literally thousands of times a year. And it all because of osteoporosis of the skull, okay? And ONA, optic nerve atrophy. And then there's vertigo. It used to be called Meniere's disease. Now it's Wallach's vertigo. That's a squeezing of the vestibular branch of the 8th cranial nerve, causing this dizziness when people stand up quickly. Sometimes they get a ringing in the ears. It's tinnitus kind of thing. They'll complain about that. And it may come and go. It'll have it for a couple of weeks, and it'll go away for a couple of weeks and come back for a couple of weeks, or they may just have it kind of permanently. And it's caused by a squeezing of the auditory branch of the 8th cranial nerve. Okay. And again, it's very easy to get rid of. You get them on the Healthy Brain and Heart Pack, get them on the MSM, vitamin D3, glucogel, rebuild the skull, and it all goes away. And Paget's disease, now Wallach's disease, that 1-inch thick skull will calm down and shrink back to a normal size. And of course, when you have osteoporosis of the skull and you're 12, 15, 16, 18 years old, you have to go to the orthodontist and have them put braces on your teeth because your teeth are kind of floating around through the skull, which you've lost bone mass, but it's thicker, it's 1 inch thick. Okay, they have receding gums, they have all this stuff going on. So they give them braces to guide where their teeth have to be. Okay, but it's really just simply osteoporosis of the facial bones in the skull. Okay, Wallach's disease, not Paget's disease anymore. Then there's trigeminal neuralgia, where the 5th cranial nerve gets squeezed. You get pain and swelling in your face. And of course, you get lazy eye, where your eyes wander around all the time. You can't focus on anything. That's because the 3rd and 4th cranial nerves are being squeezed by the skull when you get osteoporosis of the skull. Now, that's just the skull. Now, we also get osteoporosis of all the other bones in the body, the pelvis, the shoulder blades, the arm bones, the leg bones. You get degenerative disc disease, and the vertebrae get closer together, and you get sciatica as those vertebrae in your lower back squeeze the sciatic nerves that are causing pain and numbness in your feet. The same thing happens when you get Erb's palsy and you get pain and numbness in your hands, and doctors want to say, oh, you have carpal tunnel syndrome, we're going to do some surgery and cut the nerves, you won't have the pain anymore. But it's really osteoporosis of the skull squeezing the spinal cord, kind of like the sciatic nerves are being squeezed in your lower back when you get sciatica. All these are totally reversible in weeks. I do this thousands of times a year by putting them on the nutritional program and getting them off the bad food so they can actually rebuild themselves. Now, something that's current, of course, is this COVID thing. With COVID-19, people have pre-existing conditions, which we all know, obesity, diabetes, high blood pressure. They'll go to the doctor once a month for an iron shot or a B12 shot because you give it to them orally and it doesn't do any good. Well, that's because they're eating gluten. Their intestines are all damaged. So they got to get off of gluten. And usually 60, 90 days, they'll be able to absorb iron and B12 so they don't have, and their 90 essential nutrients. They don't have to go to a doctor every week and or every month and get a B12 shot and an iron shot. Also, their bone marrow, if you have what we call the metabolic syndrome, which is obesity, diabetes, high blood pressure, heart disease, and elevated triglycerides, if you have that system of terrible diseases, all of which are nutritional deficiency diseases, it's called the metabolic syndrome. It's sort of like the red warning light in the dashboard of your car. The red warning light in the dashboard of your car doesn't damage your car, but it warns you if you don't check the fan belt, if you don't check your radiator and the coolant, if you don't check the amount of oil you have, your car can burn up. So that red warning light are these pre-existing conditions, and having to go to the doctor for iron shots and B12 shots. They may give you transfusions so you can have platelets. Well, why is not your bone marrow making platelets and red blood cells and white blood cells and antibodies like it's supposed to? It's your immune system. Well, that's because when you have osteoporosis, that bone marrow cavity, which is a living thing in your immune system, gets filled up with scar tissue and fat, and it doesn't perform anymore. And so that's why a 3-year-old who's only been eating gluten for 3 years, okay, they get the COVID for 3 days, common cold-like symptoms, it's over with. But if you're 63, 73, 83, you've been eating gluten for 60, 70, 80 years, your bone marrow cavity is filled up with scar tissue and fat, and you can't make antibodies, you can't make white blood cells to go through the bloodstream and kill and eat the viruses. Now, people say, well, I've been eating gluten all my life. Why suddenly now am I having a problem? That's because the damage from gluten is not a off-on thing, okay? It's a drip, drip, drip thing. It takes a long time to get 50% of your intestines damaged, and you start getting some eczema, some psoriasis, some itchy skin and stuff like that. And older people might get some hemorrhages under their skin because they don't make enough platelets because their bone marrows are kind of going away. But then when you get 97, 98% of your intestine damaged, you only have only 2% of your intestines absorbing nutrients. If you're not supplementing, you're in big trouble. If you are supplementing, you're still in big trouble because you're only getting 2% of what you supplement. So you got to immediately get off all the bad foods. No fried foods, no processed meats, no oils, no gluten, no wheat, bread, rye, oats, no sugar. And you take your 90 essential nutrients. We have the basic program, the Healthy Start Pack. But if you have 3 and 4 and 5 and 6 and 8 and 10 of these pre-existing conditions, okay, you better be taking the bigger hammer in the toolbox, which we call the Healthy Brain and Heart Pack, and throw in the MSM and vitamin D3 and collagen or glucogel. And all these things will go away as long as you're staying away from the bad foods, the fried foods, the processed meats, the oils, the glutens. And of course, we have the good food, bad food list that everybody should have to be able to give to their potential customers and associates and distributors. And of course, the obvious ones, of course, you get osteoporosis of your leg bones, your knee bones, your hip bones, your shoulders, and doctors want to give you a $50,000 US, $50,000 knee replacement. Oh, you're going to need a double knee replacement. You got good insurance, don't worry about it. And so it costs the insurance company $100,000, $50,000 for each knee. Same way with each hip, but it still didn't heal your bone marrow cavity because you don't have any supplements. Okay, you're still going to get sciatica. You're still going to get all these other issues because you're not absorbing nutrients, even if you're supplementing. So give our program a try for 90 days before you submit to joint surgery, because you have osteoporosis of the joints, because you have disc problems, because you have degenerative disc disease because you're not getting enough nutrition to maintain the disc. The vertebrae get closer together, smash the sciatic nerves and give you sciatica. And your shoulders, okay, your neck and your thoracic vertebrae get closer together because you have the discs that are shrinking, and you get osteoporosis of the skull. There's over 100 different diseases that people get secondary to osteoporosis. It's not just a little old lady's disease that they get a fracture in their leg, because they trip down the steps. Doctors make 90% of their income from the complications and the secondary nutritional deficiencies of the osteoporosis. So I urge everybody, take the 90 essential nutrients. I'm 81 years old. Most people think I'm in my 50s because I don't have any wrinkles and gray hair and stuff like that. All my bones are like a rock. Okay, I can tell you. I had a couple of guys several years ago attack me in a mall because I got the last package of t-shirts and they wanted it. So two of them grabbed me, one by each arm. A third one tried to grab the package I had because they saw me paying for it and they just wanted to just take it and run. Well, to make a long story short, in less than 2 minutes, all three of them are on the floor, all their teeth knocked out. I only lost one tooth in the deal, okay? And I only weigh 142 pounds. There were three of them. There were 600 pounds of them against me. And that's because I've been taking the 90 essential nutrients for, today, it's like 72 years I've been taking the 90 essential nutrients twice a day. So I urge everybody to do the same. I urge everybody to make sure you're taking your 90 essential nutrients, get rid of the bad foods. And if you have type 2 diabetes, add some extra of what we call our sweeties in there. And people say, well, I've got dialysis. I've been taking dialysis 6 days a week now. I haven't urinated in 10 years. Okay, give me 90 days. Well, my doctor said, I need a kidney transplant, but I don't want that. So I'll just keep taking the dialysis because I don't want to risk the surgery. So I'll just take dialysis 6 days a week. So give me 90 days. So in 2 weeks' time, on the Healthy Brain and Heart Pack, the Ultimate Daily Classic Tablets, the MSM, to make a long story short, in just 2 weeks, they're urinating again. They dropped their dialysis down to 3 days. And in 2 more weeks, they're totally off of dialysis after 25 years on dialysis and 10 years of not urinating. I do this hundreds of times a year because when you have a kidney issue, it is not due to a kidney problem. It's due to an artery problem. Either there's pressure on the artery or you have a plaque in the arteries from eating oils and you don't have enough antioxidants come in to protect the arteries. And so you're not getting the filtering done and they put you on dialysis. You're not getting the urinating done because you're not absorbing enough nutrition for your arteries to work properly. All osteoporosis. So with that, I think, do you want me to go? We're going to be on for a total of an hour today, right? Or 2 hours?
Sure, absolutely. And we do have a lot of questions. And
okay, so let's go to some questions. I think that, I think people will appreciate the value of dealing with the osteoporosis, not, saying, well, she's 70 years old, they're going to get osteoporosis. No, you start before a woman gets pregnant so that the baby's born normal and doesn't have osteoporosis when the baby's born. They need to be supplementing so that when they're teenagers, they don't have to go to an orthodontist. Okay, and if they're going to play sports in high school and college and in the Olympics or in pro, they got to be taking the 90 essential nutrients so they don't get fractures and joint problems. And you got it. Okay.
Okay, thank you, Dr. Wallach. What a lot of great information. Now, this is recorded, everybody, so this will be posted on the New Zealand page. You can also contact me to get a recording of this. And anybody that wants to ask Dr. Wallach a question, I'm giving everybody a chance, as long as we've got enough time. Type your question into the chat box, which if you can't find the chat box, just open it on your Zoom link, type it in, and I can see it, Ken Smith can see it, or moderator Mike can see it, and we will get to you there. Mike, 1 star from Sydney. You want to unmute yourself and say good day, Dr. Wallach, and ask him a question. Go ahead, Mike.
G'day, Dr. Wallach. It's Mike from the team. G'day.
Okay,
I have
well,
a question.
good day, Mike. What can I do for you?
G'day. I have a question actually in regards to a hernia. What's the best protocol to repair a hernia just above the navel area?
Okay, so it's just above the navel. It's a belly button kind of hernia. Okay, and so this is, remember, you have this connective tissue band down the middle of your belly, and then all the muscles from your stomach go into that band. Okay, so you want to rebuild the band, but to allow it to heal by giving it this supplements, which I'll tell you in a second, you got to get one of those belts with a pad on it, so the pad holds the intestines in the belly cavity, so you don't have the intestines constantly keeping that hole irritated and open. Okay, how much do you weigh?
115 kilos.
Okay, 115 kilos, so you're about 250, 260 pounds US. Okay, so what I want you to do is get rid of all the bad foods. You can maximize absorption. Okay, no fried foods, no processed meats, no oils, no glutens, no wheat, bar, rye, oats, no sugar. I want you to also get one of those belts with a hernia on a hernia ball on it. Okay, and that ball should be on top of the hernia, and you're going to tighten up that belt as you're walking around during the day. And also, I want you to put a 4x4 under the feet of the head of your bed, so your head is going to be 4 inches above your feet when you sleep. So your gravity is going to pull your intestines back down into your lower belly and in your pelvic cavity, okay, away from that hernia. And then I want you to take 2 healthy brain and heart packs per month, 2 healthy brain and heart packs per month, a full dose of everything twice a day. I want you to get 2 bottles a month of our MSM, so you can take 3 with breakfast, 3 with lunch, 3 with dinner, and they're designed to support and promote maintenance repair of connective tissue, including that sort of like connective tissue band down the center of your belly, okay, that needs healing here. Obviously, no heavy lifting or anything like that. And this is a healable thing as long as you're doing all these things and staying away from the bad foods, maximize absorption, and so forth. But, you know, I would continue, even though it looks like it's healed and the hernia is quiet, I would still wear that belt during the day when you're out and about, and wear the hernia belt with that bulb on it, so that's taking the pressure off of that weakened part of that belly ligament. Okay?
Excellent. Thank you very much.
Thank you
You
very
bet.
much. Thank you very much, Mike. And Mike is a great one-star from Sydney, doing a lot of great things, moderating today as well on the call, helping you out with your questions. We are going to go to Stephen Diedrichs. I hope I said that name right. If you want
you
to
did.
unmute yourself, Stephen, and say good day, Dr. Wallach.
Hi, Doctor. Thanks for your time. Just a quick question for a potential customer. It has a mass on his kidney, so the doctors want to cut it out, and he doesn't want to do that.
Okay, now stop there a minute. Do they have
Yep.
any idea from an ultrasound or something what this mass is? Is it a cyst full of fluid? Is it a solid mass? Is it
It's
something? Is
yeah,
it a tumor?
I understand from him that it's a solid mass, and a CT scan was done. It's just about 1.8 centimeters long,
Okay.
and his kidney size, I think, is about 10 or 11 centimeters for the whole kidney size. Just checking my notes. Yep.
Okay, so do the doctors think this is a malignant tumor, cancer?
Well, they say it's about they're about 70% sure, and they suggested to him that they operate to cut it out.
Of course, but that doesn't answer the question. Do they say there was a
They
cancerous tumor, or they don't know?
they don't know. They think they're 70% sure.
Okay. Well, what I would do if I were him, I'd go to the university, okay, and talk to the cancer doctors there and say, okay, I need an honest approach here. Let me know if this is truly cancer. Do I have to worry about it as a cancer, or is it a scar tissue, or is it from some infection I had when I was a teenager? I mean, what's going on here? What is this? The doctors are 70% sure. That's not worthy of anesthetizing me and putting me at risk of surgery. So I want to get a second opinion here before I decide what I'm going to do. So that's what I would do. I'm having a second opinion. But in the meantime, Any idea how much this guy weighs?
I think he's about 84, 85
Kilo?
kilo, yes.
Okay, so he's got to be about 180, 190 pounds, maybe almost 200 pounds. So I would have him get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, brown, no sugar. I'd also have him take 2 of the Healthy Brain and Heart Packs per month. 2 Healthy Brain and Heart Packs per month. That's the biggest hammer we have in the toolbox. And we want to, if there's anything missing, we want to have it in this first attempt to deal with it. So 2 Healthy Brain and Heart Packs, a full dose of everything twice a day. And then I also want him to have 2 bottles a month of the MSM, so he can take 3 of those with each meal. And they're designed to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue here. We'll keep our fingers crossed and hope that it is just a connective tissue mass. Okay. It could have been an embryo, could have been a twin that he kind of folded up over when he was an embryo. Okay. It could have been one of those kind of things. And so we need to see if there's any teeth or bones or hair or anything like that in that mass. And so we need to have another. He doesn't have to do the radiation again. We can have another set of eyes look at the original test. That's what I would do rather than do radiation again. Have somebody who's a professor at the medical school look at the original test and see what they think about that mass. Okay.
Yep.
Okay, because it could be what's called a hydatid cyst, where there's another baby inside that thing. Okay, let's have a look at that. But at any rate, he'll be supporting his immune system. His immune system is going to come along, improve, and start looking at that mass in his kidneys. His immune system will. And this will give time for the people in the medical school to look at the tests that have already been done and make their determination on what it is. The fact that the doctors say, well, we're 70% sure that it's a cancer. Well, to me, that's pretty weak for somebody to undergo surgery and the risk of surgery and all this, that, and the other. Let's get another opinion from the same test. Don't have to have any more radiation, no more tests. Just have somebody else with the proper training look at that again. Okay.
Thank you.
You bet.
Thank you, Stephen. I've got a quick question here. John from Adelaide, 55 years, 220 pounds, wants to know how to detox and maximize the absorption of the Youngevity products. He's just started the correct foods and protocol.
Okay, good. Well, that's a good thing. You get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, brown, no sugar. It needs to eat like an Asian, live on rice and sweet potatoes and vegetables and fish and poultry and red meat's fine. But he cannot have fried rice. He can have white rice, yellow rice, red rice, wild rice, domestic rice, but he cannot have fried rice because that's got the heated oils in it, right? Then I'd have him, and you said he weighs a couple 100 pounds, right?
220.
And 220, okay, yep. And so I'd have him take 2 of the Healthy Brain and Heart Packs per month, 2 Healthy Brain and Heart Packs per month. And by absorbing all these things, he's going to get the maximum benefit to his immune system, to his liver, to his heart, to his muscles, to his bones. And so, but, let's go that direction, okay?
Thank you very much, Dr. Wallach. Michelle Graham, big distributor there in Queensland. Do you want to unmute yourself? You've got a couple of questions.
G'day, Jamel. Thank you. Dr. Wallach, I've got 2 sort of fairly urgent questions.
Okay.
One of them, Graham has a malignant melanoma and he's on 1,000 milligrams of medical cannabis a day. The tumour has shrunk about 14 mils since he's been on the protocol, but it appears to be putting a huge load on his liver.
Okay, now stop. Now you say the protocol, you're just talking about the cannabis?
Yeah, just the cannabis. He's not on the
he's not
90.
taking any nutrition. He's not on the 90, okay.
No,
yeah.
no.
Okay, well, I'll tell you right now, he needs to get rid of all the bad foods.
Yeah.
Okay, and the cannabis can help relieve inflammation and pain, but I would make sure that he's, he needs 2 Healthy Brain and Heart Packs, a full dose of everything twice a day. I'd also have him take other heavy-duty antioxidants to support his immune system. I'd have him take the, let's see here, pollen burst. I'd have him take the pollen burst with our SOD. He can take 2 servings of that a day. I'd have him take our Cell Shield RTQ. He could have 2 servings a day of that one. And they will also calm things down, okay, like the cannabis will, but also they will also support the antioxidants. They will calm down free radical damage, which is what causes malignant tumors, okay, to move around and get into other organs and things, which is what kills people. Okay,
Yeah.
so I would do that rather than just taking the cannabis. Somebody needs to go to jail if that's all the doctors gave them.
Yeah. So his ALT enzyme score has gone from 34 to 189 in 6 days, and the doctors can't figure out why.
Well, because they're not treating it; they're just relieving his discomfort.
Yeah. Okay. So does he need to do something to support his liver?
Well, I just told you what to do. 2 healthy brain and heart packs per month.
Yep.
Okay. There's 225 nutrients in there. You want me to list them all?
No,
we don't have enough time. Okay.
No.
So 2 healthy brain and heart packs per month. Okay. And your immune system requires all these nutrients.
Yep.
Okay.
Yeah.
And so then, of course, I want him to take the pollen burst. I want him also to take the cell shield RTQ, which is a step further in supporting the immune system, also calming things down so that the tissues can heal themselves. If everything's always under pressure, okay, like it's being cooked on the stove, then you're never going to heal, and the cancer is going to go everywhere. Yep. So you need the pollen burst and the cell shield RTQ to help calm things down and support the immune system.
Okay.
But he needs the 90, okay, the 2 healthy brain and heart packs, MSM. All right.
Yep. Okay. And then George, one of our distributors, fell out of a tree yesterday and has 5 cracked ribs, and they've got him on morphine. He's saying, is there anything natural that he can take for painkillers?
Well, I'm assuming he's on the 90 if he's one of our distributors, correct?
Yes.
Okay.
Yes.
Well, he needs to add the MSM. Okay. He needs to add the MSM. I'd have him take vitamin D3 extra, 3 of those twice a day. The MSM, I'd have him take three times a day. It's 2 bottles a month to help rebuild cartilage, ligaments, tendons, connective tissue, bone matrix, bone itself. Because he's got a crisis here. He's got fractures. He's got trauma. So he needs more than just, the standard maintenance approach. Okay.
Yeah. Okay. And that'll do it. What about pain? Well, pain relief.
Well, this is where our Hemp FX, okay, you can use topical pain relief as Soothe, plus our trauma oil, which comes from our aromatherapy oil division. Take 5 drops of the trauma oil, put on a teaspoon of our Soothe, which is our Hemp FX. There's no THC in it, so it's legal in most countries. If it's not, we have our CM cream, which you could take and apply topically to the pain. We don't sell drugs that require a medical doctor to write a prescription for, because, they are, what should I say? They're bad drugs.
Yeah. Yeah. Okay. All right. I'll let him know. Thank you.
Okay. God bless you. Keep up the good work.
Thank you.
Michelle. Thank you very much. Hey, Trish, and the reason why I asked where you're from, because sometimes there's 2 people or 3 people with the same name. So, Trish, if you want to unmute yourself and ask Dr. Wallach a question, go ahead.
Hi, Dr. Wallach. I'm here in Auckland, in New Zealand, and I want to talk about my husband, who is 73. He weighs 155 pounds, and he's 5'7". And he developed and he's been a diabetic for 33 years. I've had him on a lot of your stuff over the years, and but in 2014, he was diagnosed with hippocampal atrophy and also frontal parenchymal or something loss. And so we've got his weight down to normal. He was, he was several.
Okay. That's enough. Okay. Hippocampus injury is the brain. Okay.
Yep.
Now, diabetes you should be able to get rid of in 2 weeks. Now, if you were giving him our healthy blood sugar pack for 20 years, okay, or 15 years or 10 years, and he still has diabetes, okay, he's eating gluten, he's not absorbing efficiently the nutrients. So he's got to get rid of all the bad foods. No fried foods, no processed meats, no oils, no glutens, no wheat, butter, iron, oats, no sugar. And when I say no glutens, this includes beer.
I don't know. I've
Okay.
got him on a very strict keto diet, and we, you know.
Okay, and stop.
Yep.
You can keep people on a keto diet and they're still getting gluten. You know,
How?
one day a week they go out to the spaghetti factory and have spaghetti, or every Friday night he'll go out and have 3 beers with his buddies.
No. No, he
But
doesn't.
he needs to be on 2 healthy blood sugar packs. Okay. And don't take him cold turkey off his medication. Just reduce his medication based on his A1C numbers and also on his blood sugar numbers. Do it by the numbers. It might take 2 weeks to 4 weeks to 6 weeks to get him totally off his medication and get rid of his diabetes. So how long does he have to be on these nutrients? Forever. How long does he have to be gluten-free? Forever.
So
Okay.
can I ask you another question?
Okay.
His cholesterol is really high.
Okay, well, that's good because testosterone is 95% by weight cholesterol. Do not let him take statin drugs. Okay. Why is his cholesterol real high? Does he eat everything fried?
No. No.
So where's he getting his cholesterol?
Well, I give him four eggs a day, and we, you know, it's mostly.
That's not enough. He needs 3 times a day. And they cannot be fried. They cannot be hard boiled. They got to be soft scrambled in butter.
Yep.
They got to be soft scrambled in butter. Okay.
We're doing that.
Or they can be soft boiled or soft poached, soft yolks. But 350 to 550 is where your cholesterol should be. Doctors want you to get it down below 200. No. Okay. And they'll give you statin drugs to lower it. Well, you're going to wind up with Alzheimer's disease. I'm sure your husband has some memory problems. Is that correct?
He does. And then he's getting, he's not able to articulate himself like he used to.
Yeah. Okay. Well, he needs to be taking 3 eggs with each meal, soft yolks, and get rid of all the bad foods. Take 2 healthy brain and heart packs per month. He also needs to take the Ultimate Daily Classic tablets because you can have artery problems in the brain and have dementia. Okay. It doesn't have to be Alzheimer's disease. There's 8 different dementias. And so let's start there. And let's see if he wants, he can have a couple of our protein shakes per day, but make them with heavy cream. Don't make them with water, make them with heavy cream. I want to rebuild his brain, but he's going to have to take cholesterol, no statin drugs. And I take people who've been in comas for 8 years and in 3 days' time being fed through their G-tube of just what I've just shared with you. They get up and they go back to work. They thought they were only asleep for one night. They didn't realize they were in a coma for 8 years being fed through a G-tube. But people can recover extremely fast, even with brain issues, if you give them all the nutrition and keep them away from the bad foods so they can absorb it. No cheat days. No cheat meals. Well, can't I just have 1 beer per month? No, not if you want to live. If you want a beer, drink Japanese and Chinese beer made from rice. Okay, or drink wine, which is made from grapes and berries.
Thank you.
You're welcome. Keep us informed. He'll be a great testimony if he does everything right.
Yeah, I have to do it for him.
Well, we get him fixed and then he won't have to have it done for him. He'll be able to do it himself.
Thank you.
Okay, good day.
Good day.
Thank you very much. We're going to go to now, everybody, if you do have a question, you type it in the chat box. Let me know what your name is on Zoom call too, because if I can't find you, I don't know if you're still on the call. So that's very important. I want to thank Dr. Wallach again for his time. This is very,
well,
very
we look at you. We look at you guys, you know, as brothers and sisters. So we look at this as a family event, and we appreciate you. We don't look at it as a burden. We look at it as, you know, a friendly, helpful, supportive family event. So thank you so very much.
Thank you. Be healthy, I said Bethany. If you want to unmute yourself, ask Dr. Wallach your question and go ahead.
Oh, hello, Dr. Wallach.
Hi.
Nice.
How can we help you?
Nice to talk to you. I've got a few issues. I'm 69, 251 pounds, 5'3", suffer with hiatus hernia, celiac disease, fatty liver, insulin resistance, metabolic syndrome, asthma, and now getting pulsatile tinnitus, and also have had rosacea.
Okay, now you're committing suicide.
Yes, I know.
Okay, so all of the things you have are secondary to gluten. Okay, you have a gluten issue,
Yes.
and you haven't dealt with the gluten issue, and so this is why you have 8 of the things you've mentioned here are from secondary to gluten consumption.
Yeah, I'm on a gluten-free diet, yes.
No, well, how long have you been on a gluten-free diet? For 24 hours?
No, a long time.
Okay, then you're getting gluten from somewhere. Do you have people in your house who are all eating gluten?
No, no.
Do you work in a bakery?
No, I'm retired now.
Okay, are you eating oats?
No,
Do you drink beer?
no. I do.
Okay.
I do have. I crave sugar, so I do have sweets now and then. Well, probably
Okay.
more often than I should.
Okay, now you need to be reading labels here because, you know, I had a guy in the United States who had a similar situation for you, had all these different issues that were secondary to gluten problems. Okay, like the asthma and the skin issues and the obesity and all this kind of stuff. This is all gluten issues. And he just said, I do not eat gluten. I said, okay, let's have a little wager here. Okay. He said, okay, I'll bet you $1,000. I said, you're on. We're going to go right now. He said, no. Yeah, we're going right now because I don't want you to go home and clean up your house. Okay, we're going right now. And if I find one source of gluten in your house, you're going to give me a check or cash or whatever it is for $1,000 right now. If we find no gluten in your house, I'll write you a check. Or if you want to, you can run my credit card for $1,000. He was kind of hesitant. He says, oh, okay. So we get there, and I open up his cupboard in his icebox. I found 12 sources of gluten. I said, you're lucky we didn't say $1,000 for each source. Otherwise, it'd be $12,000 you'd owe me. Give me the $1,000. Okay, you had to pay off. Okay, you have gluten in your life, and you have to find out where it's at. Read labels. Read labels. Even if it says gluten-free, you still need to read the labels because they could have oats in it.
Yes, I understand. Yes. Yeah.
Read the labels because you're getting gluten somewhere when you're having all these issues. All these are secondary always to gluten consumption.
Okay.
Do you have a dog or a cat?
No.
Okay. Do you have somebody else living in the house with you?
No.
Do you have grandkids who come visit you?
Yes.
Okay. Well, do you wash their clothes in your washer and dryer?
No.
Do they hug you?
Yes.
Okay. Well, you need to make them strip naked out in the yard and hose them down with a hose before you let them in the house because they're bringing you gluten every day when they come to visit you.
Oh, okay. All right.
Yeah, hose them little guys down in the yard. Say, sorry, you can't come in. You just got to get naked and come in the house after I hose you down.
Okay. That might be a bit difficult, but.
But then I want you to get on 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month. I want you to get our sweeties. I want you to take 3 of those with each meal. That'll be 3 bottles of our sweeties per month. Then I want you also to take 2 of your 3 meals a day are keto caramel meals. It could be the shake or the bar. Doesn't have to be the same meals every day. It could be rotated around based on your schedule. If you don't have a lot of time, just eat a bar. If you have time to make the shake, you can make the shake, right?
Okay, yeah.
Okay, and you'll lose a half a pound to 2 pounds per day. So in 2 months' time, you'll be down to where you need to be if you do everything right, as I've told you. But you got to get rid of the gluten so you can absorb the nutrition. When people are not absorbing nutrients, they get a behavior called pica, which they just crave something all the time.
Yes.
You just crave to eat food. Yeah, you have these cravings. It's called pica. Look it up in the dictionary, P-I-C-A, and they'll just say obsessive cravings for food. Okay, but they don't tell you why. Well, I'm telling you why. It's because you're minerally deficient because you're eating gluten. You can't absorb it even if you were supplementing. You're minerally deficient. And when you have a deficiency, it's called cribbing. In the old days when kids used to eat the top rail on their bed, that little rail, that's why they put that fiberglass shield on there so they won't eat through that. Horses, they eat the top rail in the barn. They call it cribbing because it looks like they're eating the top rail in their stall in the barn, like the kids eating their crib. So they call it cribbing just like they call it for the kids. is cribbing. But when you get to be an adult or a teenager, they call it pica, P-I-C-A, okay? And one of those things where prior to 3 o'clock in the afternoon, Monday, September 4th, 1882 on Pearl Street, New York City, on the bluff overlooking the construction of Brooklyn Bridge, if you wanted to see somebody who was overweight and obese, who weighed more than 200 pounds, particularly women, you'd have to go to a circus or a carnival to see the fat lady. Okay?
Yeah.
Well, that's because everybody's putting their wood ashes in their garden, which were minerals.
Yeah, I understand. I've been taking your product for about 8 to 10 years.
Yes, but you're hugging your grandkids who are eating gluten.
Yeah. Okay.
You're cross-contaminating you. That's the problem.
All right.
Everything you have is a gluten deficiency.
Yeah.
Asthma, okay? Eczema, dermatitis, bowel problems. All these things are caused by gluten consumption, okay? And you're breathing it in. It's on their clothes. You're putting it on your clothes. And so you got to make them little suckers get naked out in the yard and hose them down, make them twirl around, lay around, hose them down 5 times before you let them in the house.
Okay then, Doc.
Okay.
All right then. So what product do I need to take? The Healthy Grain and Heart Pack? Is that what you said?
Yeah, I said 2 of them.
Yeah,
because it's 1 per 100 pounds of body weight, and you've got it all recorded.
I've got it all recorded. So
all right. Thanks, Jamel.
No problem.
Okay.
Don't worry, I have all this recorded, and we got about 20 minutes to go to the bottom of the hour. So I do have 2 people that have been RSVPing. So we're going to go to Jan, then Felicia, that's got a 2-year-old for her sister, Jan in Cairns. If you want to unmute yourself and ask Dr. Wallach your question, go ahead.
Hello, Dr. Wallach. How are you?
Hello. Okay, Jan, how can I help you?
I was wondering, I'd love to know what to do to make my life a lot better from having fibromyalgia, and I have compressed discs in my neck.
Okay, do you have any skin problems, any eczema, dermatitis, or psoriasis?
I'm starting to get a few skin conditions.
Okay, did you ever have asthma when you were a kid?
For a short period of time when I was 12.
Okay, did you have your appendix taken out?
No.
Okay, do you have any brothers and sisters?
7.
Okay, did any of them have any of those problems?
With fibro, no.
No. Asthma, skin problems, bowel problems, appendicitis.
My father and sister have skin problems.
Okay, and your sister is from your same mother, correct?
Yes, all of them.
Okay, yeah, so they all have the same thing. So they all have a gluten problem, just like you got a gluten problem, okay? So you need to get rid of all the bad foods. And I apologize, how much do you weigh?
In pounds, around 136.
Okay, 136 pounds. So I want you to take 1 Healthy Brain and Heart Pack per month, a full dose of everything, half a dose of everything twice a day. I want you to get the MSM, get 1 bottle a month of that, so you can take 3 of those twice a day or 2 or 3 times a day for a total of 6. They're going to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, skin, blood vessels. Do you have any varicose veins in your legs?
Not yet.
Do you have any white, gray, or silver hair?
Yes, I have white and silver hair.
Okay. Yeah, well, that's caused by deficiency of a particular nutrient that can result in varicose veins, arthritis, aneurysms, all those kinds of things are caused by that same deficiency. So when you see that hair color coming back to normal, whether it's black or brown or red or whatever color it was, right, normally, when it starts going back to the normal color, you know you're absorbing properly and you're healing. But if your hair keeps getting whiter and whiter and whiter and whiter, or more gray, that means you're not absorbing efficiently, okay?
Certainly. They have removed part of my bowel.
Yeah, that's a gluten. Yeah, that's a gluten issue. And it could be the appendix. It could be part of your intestines. You have ulcerative colitis, Crohn's disease, celiac disease. And, you know, the doctors, instead of saying, okay, give us 90 days to heal your intestines here, get off of gluten, get on the 90 essential nutrients, they'll just cut your intestines out.
Yep.
Okay. And those doctors should go to jail.
Thank you, Dr. Wallach.
Okay. God bless.
God bless you too.
Thank you, Jan. Hope things are nice and warm up there in Cairns. I bet you they are. And let's go to Felicia, whose sister has a 2-year-old. Felicia, if you want to unmute yourself and ask Dr. Wallach your question, go ahead.
Okay. Hi, Dr. Wallach.
Hello, hello. How can we help you?
Okay. So I have a 2-year-old son. He's about 44 pounds, 100 centimeters tall. And the best way I can describe it is he has like this problem with his hands, like married hand movement.
I'm sorry, I missed that. There was a blank there for a second. All I heard was hand movement.
So his hands, like when he does something with one hand, the other hand does the exact same thing.
Okay.
So kind of married hands.
Okay, yeah, this could be a osteoporosis of the skull, squeezing his spinal cord.
Mm-hmm.
Okay, he could also have disc disease or problems with his vertebrae in his neck and upper back, causing pressure on the nerves to go down his arms into his hands.
Okay.
Okay, and you say he weighs 44 pounds?
Yeah.
Okay, well, I get him a Healthy Brain and Heart Pack, and that will last him 2 months because I want him to have a half a dose a day, and you cut that half a dose in half, so he's going to take a quarter of a dose at breakfast and a quarter of a dose at dinner time, okay?
Yeah.
So that one Healthy Brain and Heart Pack will last him a total of 2 months.
Okay.
Okay, so it's not going to be expensive, but he also needs to get, and you and dad or renter, roommate, dog, cat, bird, fish, grandma, everybody's got to be drop dead gluten-free so he can absorb it, okay? Yeah. And at his age, he will recover extremely quickly. I see these kinds of things all the time. And of course, the doctors will say, well, yeah, it's an immune disease. He's got an autoimmune disease, and this will just get worse and worse and worse over time. And you can look for him to be in a wheelchair. We'll have to put him in a home. That's all nonsense.
Okay.
You get him off the bad food, get him on the 90,
yeah,
and give me a call every 2 weeks, because I'm on every Friday afternoon here, okay? Yep. So call us every 2 weeks and bring us up to date and let us know his, current weight every couple of weeks and everything. Let us know if it's staying the same, getting worse, getting better, and we'll walk you through this because this is a reversible issue.
Okay, yeah. Can I just ask, because I know I had a very traumatic birth, like he was forceps delivered. Do you think that had anything to do with it?
Well, has he had this problem since he was born, or did it just develop in the last couple of? Okay, no. So he did have some. He had some. Did he have like paralysis or hand movements when he was like that when he was newborn?
Yes. Yeah.
Okay. Well, it could be due to osteoporosis of the skull, which you can be born with.
Yeah.
It can also be due to having the forceps placed incorrectly.
Yeah.
Okay, and squeezing the spinal cord.
Mm-hmm.
Or the vertebrae, or the disc between the vertebrae. And so what I would do is I would go to a chiropractor who has who has one of these ultrasound machines. I don't want him to have any radiation to his head or neck. I want him to have an ultrasound of his neck and see if there's any impingement on any of the cervical nerves or the cervical spinal cord. I want to see if there's anything wrong with his the back of his skull, but do it, with a non-radiation. Okay. Okay. But go to a chiropractor. Go to a chiropractor. Do not.
I do. I take him to a chiropractor weekly. So.
Okay. Does he show temporary improvement after an adjustment?
Yeah.
Okay. Well, that's a good thing. That means he will recover quickly with the nutrition and getting off the bad foods.
Okay. Perfect. Thank you.
Okay. Look forward to hearing from you.
Thanks.
Bye-bye. Mm-hmm.
Bye.
Thank you very much. We've got time for one or two. Everybody that has RSVP'd their questions, thank you very much. Bronwyn, I think you're a distributor. Unmute yourself and ask a question for Dr. Wallach. And if we have time for one more, we will go to that. Go ahead, Bronwyn.
I was having trouble unmuting myself. Hi, Doc. I just wanted to know because I remember a time they talked about gluten-free pastas and to be careful that they could have products in them that doesn't make them gluten-free. Can you tell me what it is that is the ingredients that we should not have in pastas?
Okay, well, oats okay? And they'll say, oh, these are gluten-free oats. No, gliadin is what gluten is called in oats, but it's still gluten. Also, there's some types of a adhesive that they use for pizzas, and it breaks down, and they say it's gluten-free, but don't believe it. So if you're going to eat a gluten-free pizza, it's got to be a mixture of, let's see here, rice flour, potato flour, and also I like to use cauliflower. Okay.
Yeah.
Okay. Cauliflower. And those are certified, guaranteed gluten-free. Rice, flour, potato flour, and cauliflower. Okay. And so I will eat one of those kind of pizzas. But it's got to be in. I don't eat the processed meats, so I'll have some tuna on it, maybe some fish or the cheeses, the vegetables. I'll have hamburger. I'll have steak, but I won't have pepperoni. Okay, I won't have that kind of stuff, bacon and pepperoni pizza, which tastes good, but it'll kill you.
Yeah. Oh, you know how the pasta, like the pasta that I thought I bought, that I read and I thought it was well, it said it's gluten-free, but it has corn flour in it, and I didn't notice that.
Corn flour. There's no gluten in corn flour. If it's 100% corn flour, there's no gluten in corn flour. No gluten in corn flour. Gluten is in wheat, barley, round oats.
Okay.
Wheat, barley, round oats.
Yeah, because I noticed that corn had been stuck on the bad foods list.
Well, you have to appreciate that. What should I say? Corn can be bad because it makes you gain weight. Okay, corn can be bad because it can have a fungus on it that can cause liver cancer.
Okay.
And so, but there's two ways to look at it. When you look at Germany, okay, and Italy, which are neighboring countries, they touch each other, right?
Yep.
The Italy has the highest percentage of death rates from COVID of anybody. 10% of their cases die. Germany, their next door neighbor, they have the lowest rate. They're the neighbor. If it's an infectious disease, they should be the same, right?
Yep.
But they have the lowest rate is 0.5%. What's the difference between 0.5% and 10%? Well, the fact is that Italy, everything they eat is gluten.
Mm. Yeah.
And in Germany, everything they eat is potatoes. German potato salad, right? Baked potatoes, sweet potatoes, right? Okay. And so they're getting most of their calories from potatoes and corn. Okay. Whereas Italy is getting almost all their calories from wheat. Plus they drink beer and scotch and bourbon and rye whiskey and all that kind of stuff, all made from wheat, barley, round oats. So that's why the Italians have such a hard time.
Thank you. Thank you so much. Thanks, Bronwyn. Thank you so much, Dr. Wallach. I'm going to thank you again, and we're going to see you all next week. Don't forget to get your questions in. And what I do is try to go to everybody's question. If you haven't had a chance to talk, I try to go to the new person, just get all that information in so I can address you and give Dr. Wallach the information that he needs when he gets on the call. So make sure you got your chat box open so we can communicate. And we've got the two moderators, Ken Smith, who has been a great moderator today, and One Star Mike, who is also in Team G'day. Ken, do you want to take us out with Dr. Wallach? Thank you, Dr. Wallach. Ken Smith, go ahead.
Hey, Doc.
Okay, thank you, Jamel.
Thank you.
Thank you, Ken.
My friend. I want to, just real quick, I want to mention two things. We got a lovely Tracy on tonight as well. It's absolutely fantastic, and it's great to hang out with you every week, Doc. And we can't wait to travel and get over there, buddy.
Okay. Thank you, guys. I can't wait to travel and get over there. Lieutenant Colonel Wallach, over and out.
Thank you very much. I'm going to unmute everybody so you can say goodbye and aloha to Dr. Wallach until next week.
Thanks, Doc.
Thanks
for bye, Doc.
Hey, hasta la vista, baby.
Thank you.
Good day.
Fantastic.
G'day, I'm Jamel Boukabou, 2-star executive with Youngevity International. You're about to hear from the world-renowned, famous naturopathic doctor, Dr. Joel Wallach, book in the Smithsonian, author of the book Dead Doctors Don't Lie, which sold 500 million copies on audio, book in the Smithsonian, nominated for a Nobel Prize in Medicine, and recent keynote speaker at the Tesla event. I'm not a doctor or a healthcare professional, but I believe Dr. Wallach is the best naturopathic doctor on the planet. So please consult your own healthcare professional for health advice. I am a distributor, so if you do want to know about how to earn money while using the Youngevity products, contact myself or the person that's referred you to this video. Aloha.